Hello, my name is Dorla Harris, and I'm the Senior Manager for Children and Family Programs at MOSAIC, which is an immigrant-serving organization here in Vancouver. One of the programs that I oversee is called the Newcomer Center for Children and Families. It's part of a network of programs that are called the Early Years Refugee Programs that were specialized to support refugee families with children under the age of 6 to settle into their new communities and to learn what early childhood development looks like in Canada, to orient the children as well as the families to how to integrate into using mainstream preschool or kindergarten, schooling, and help the parents to understand where they can find resources to help them to support their families to be healthy, to support their young children to be healthy. The family I'm going to speak to you about today arrived 3 years ago and came to our program after settling in Burnaby. They originally came from Iran, and they are Kurdish speaking. There was a mom and a dad who were in their early 30s, as well as 2 young children, ages 5 and 3. Soon after arriving to Canada, the dad was diagnosed with a severe health problem, and the doctors determined that he needed a pacemaker, but because he's so young, the doctors were hesitant to undertake that surgery with him. So he continues to live with not only trauma from the journey of the refugee journey that they have undertaken, but also with some severe health problems. And those problems affect the daily life of this family in a ways that create a lot of challenges for integrating and for being able to settle successfully in Canada. For example, this health problem is linked to their under-housing issue. This family of 4 live in an apartment with 1 room. Because of Dad's health concerns and because of the trauma that he faces, he will wake up on a daily basis in the evening screaming from either nightmares or from feeling like he's unable to breathe due to his health concerns. This wakes up Mom, this wakes up the children. Mom's forced to calm down Dad as well as calm down her children and calm down herself. So with young children who are needing to engage in either school or in the community, that's not a good night's sleep to start, as well as the concerns and the impacts that that puts on Mom and Dad. The family is on the BC housing wait list, but Mom knows that when those choices come up, she may have to choose between getting a bigger house that's not in Burnaby or staying in inadequate housing, but staying in Burnaby where she's been able to create a small network of friends that help her when Dad needs to go to emergency, when she needs to go to the hospital. She's got that network and friends in Burnaby, but she has insufficient housing here. So she's anxious that is she gonna have to choose between better housing and more social isolation, or is she gonna choose her network of friends and continue to live in inadequate situation? This year, Mom came to our center and asked for help around income assistance. She had received that dreaded letter from the ministry stating that if she does not engage in more job-seeking activities or looking for work, the family would be at risk of having their income shut off. But due to, obviously, Dad's issues, he's unable to actively participate in English language learning or going to work. And Mom has also started to exhibit physical ailments such as chronic pain in her feet and in her arms. They are unable to work. They're dealing with depression, they're dealing with trauma. And all the while this impact has anxiety-producing impacts on the children. So there is a lot of conflicting challenges that work against immigrant and refugee families who are also starting behind the 8 ball of these transportation loans, which they are also required to pay off. So Mom has worked with Newcomer Center staff to try to address the system, to address going through the new centralized system for the Ministry of Social Innovation and Development, to try to fill out forms for disability, to try to fill out forms for persons with multiple barriers in order to prevent their sole source of income from being cut off in the month of December. But it's a challenge. It's a challenge for the staff that work with me, and it's a challenge for these parents who have limited English. So I really respect the recommendations that were identified in this report card that speak specifically to the experiences of immigrant and refugee families, such as the transportation loan, and to be able to support immigrant and refugees to more successfully integrate into the community, because they have an extra set of barriers that the families here who are currently living in poverty are not facing. So I hope that with the work that's being done here, that this can be highlighted, and with the arrival of the Syrian refugees, these challenges are only going to become more magnified as time goes on. So I'd like to thank you for listening